So, ladies and gentlemen, we are back. You know, I'll tell you something. You know, some people might say, well, why don't you keep it quiet? Why you look so good? Everybody tell you, but you're not aging. You look real good. You know, it's sometimes, and this is my good friend Charmaine and Dr. Ortega. Dr. Ortega, how are you?
How are you?
Great, great. Well, watch you. Oh, your boy, excellent. Charmaine, what have you? What's going on? I'm so happy to see. I know we have to do lunch, but let me tell you something. I try my best. I take it. I watch me. I eating. I juicing and all kind of thing. But let me tell you something. You have to exercise. Doctor is here. Charmaine, you were telling me about the P.R.P. I did, right?
Yes, the P.R.P. on your face.
What's the P.R.P.?
The P.R.P. is a procedure that that doctor does. Like, take your own blood and he takes out the platelets in a machine, and they and they put it back on your face.
Wow! So doctor is here. So doctor, what have you been up to?
¿Qué estaba haciendo, doctor?
Trabajando.
Mucho trabajo. Yeah, he said
he's trying to connect with patients and let them know about the new things he has.
I saw you that I heard about this thing, and I think I did it by you a couple years ago or last year, the regeneration. Yeah, the regeneration, the one that restores your cell and your
cells, your organs, and your tissues.
The regeneration.
The regeneration is a combination of vitamins and
oligoelementos. Vitaminas y oligoelementos.
And other medication that doctor would put in a drips bag.
What are some of the medication that the doctor... Okay, let him explain to me the regeneration. What is regeneration about?
La medicina regenerativa es muy amplia porque incluye la ingeniería, las células madres y el tratamiento con sus oligoelementos y vitaminas, que es lo que estamos haciendo actualmente. Para hacer tratamientos completos...
Okay, he's saying that the regeneration, it's a complete treatment that works with like your mother cells in your blood, like the stem cells in your body, and it's as a combo like with vitamins and other medication that he would use to regenerate tissues, cells, organs in your body. And that works with your head, your lungs, your liver, your kidney, and your whole pancreas systems. And it's something like they used to call long ago anti-age, but they don't call it that anymore. They call it now regeneration.
I just want to show you. Watch it. A little thing, a poquito, little thing, but that's plenty eating. I eat some. Watch for. Somebody's can't help it to eat, you know. Doctor can't help it, but he's doing like he did my nose, you know, under the chin and thing.
Nose under your chin, your eyelids, and little things that.
What are some of the surgeries he's doing here? Tell me what are some of the surgeries you're doing here that you can do, cosmetic wise and others.
¿Qué está haciendo aquí?
Bueno, las cirugías que hemos hecho actualmente en Trinidad, blefaroplastia, rinoplastia, mamas, LIPO, tummy tuck.
Okay, well, doctor is general surgeon to us, so he's also doing hernia surgeries and all that. Eyelids, nose, facelift, breast implants, tummy tucks, LIPO, and he's also accident and emergency for burns and all that.
I tell you this today, before doctor goes, that when I first found out about him many years, and he did work for me, like come on, like, and fix me up nice. When I went down by his clinic, I couldn't believe it, you know. The clinic in Margarita, amazing. He has a hospital, like a big place in Margarita, amazing. And there are a lot of friends that he has done work for, a lot of friends under their eyes and whatnot. They will take out the wrinkles. Like I don't want to take out my glasses, but as you can see, I have none.
No.
You know, they did, you know, I have none. I sometimes don't believe in that. I don't like this. I rather take it out completely. Like, you know, if your skin, like a saggy thing and thing, I don't like that.
You prefer to just like take out all the extra skin?
Yeah, just take it out and tighten it up and, you know, look real tops. But there's an injection. I saw a couple of friends of mine who had like arthritis problems on your knees
Yes.
and whatnot, and they did an injection. What's that?
It does the same thing. They take the blood from your body and they centrifuge it in the machine and they inject it back into you. Of course, he put his little medication in it.
Yeah, and some of them had an arthritis problem. They came and up to this day, it's about 5 months now, or 6 months, and they said it's much better.
Yes.
Much. And you know, with that, the more you do, after a while, that's it, because the more I've done in my face, it's like the less you believe it, the less.
Yes, because it activates all your system inside and all the collagen and everything comes
because
out.
I always feel that this is, watch my baby thing here, watch it.
Come on, baby.
No, but I'm happy you're here. I'm really happy you're here. Really happy you're here. Tell him that.
Está feliz que tú estás aquí en el programa.
Y yo estar aquí con él, compartiendo este momento.
He says he's happy to share this moment with you.
Yeah, and we have to do lunch. You want to open up? Researcher, should I open the lines? Yeah, we can take 2 calls, just 2 calls, but put up the numbers that they can reach Doc. But Doc, you're the best, yeah? You're the best. I remember the first time remember when I went to the clinic the first time? Oh, good, I was like I was real obese, yeah? That is years ago. And here now, boy, watch me, doctor. And Doc said, take out your clothes. And he knows everybody does. And watch me, real kind of hard, what business, sir? And he come with the marker. Yeah. So, again, tell me more of your services.
¿Qué otro servicio que se puede ofrecer?
Bueno, lo que pasa es que también hacemos, la cirugía plástica tiene varias ramas, ¿sí? Oncoplástica, que es la parte reconstructiva oncológica.
He said his plastic surgery has different stages. They do with cancer patient also to recuperate.
Patient?
Yes.
And I remember, and let me tell you something, and this is serious. Don't ever, and I tell you this today, he and I had a little falling out, and I want to say it on television. Tell him.
Yeah, que él se tenía como una discusión contigo.
Yeah. Problem, because I got angry with Doc because
Que se puso bravo.
on everybody, Doc have to get this test, that test, this test, cardio, this, too much test before you get a surgery. I was like, okay, but he plays it by the book. And I can tell you that on national television, he plays it by the book.
Que usted siempre pide todos los exámenes y él les decía que yo soy bien, yo estoy bien, pero...
No,
and he was like, you need to get this, you need. Hi, caller, good evening. One call before we go. Okay, we lost that call, so we're going to wait for the next call. But nevertheless, and even Trinidad, they did some work, you know, I did a nice little job, and I had to get so much things. But it's good, it's good,
yes.
It's good. It's not about, you know, the money and this and that. I can tell anybody that. And I had the opportunity, right, to do work abroad. By a surgeon, a plastic surgeon, and I refused. I said, nah. And even in Trinidad, I said, nah. I said, I will wait when Dr. Ortega comes here, or I will fly across for a weekend. I believe in this guy. He's the only person that can do any kind of surgery for me. I mean, we have doctors here, but I mean, I have my doctors, you know, Dr. Rai, I have the former medical Minister of Health here, who is also my doctor. Hi, caller, good evening. You're live on Crime Watch.
Hi, good evening. I'm just calling to find out what's the average price of the liposuction.
No, wait. Price, lady, you have to do consultation, and you know, you have to do
what's on average for everything? Average.
They wouldn't, I don't know.
Good evening. Okay, I can't really give you an exact average because everybody would be different. Some people are very small, some people are very big, but that's why doctor asks for consultation so that he could see you and he could give you...
How much a consultation?
Hay que evaluar al paciente.
Consultation is generally between $500 and $600.
$500 and $600 for doctor.
TT, yes.
TT, a consultation.
Yes.
Okay, so now that we have that, we established that, so you get your consultation fee and go and see doctor. So doctor, again, it was so nice having you on my show. I really, really appreciate it. You treat me so good. And you make sure, I'm not calling no name, but next time when I go to Margarita, make sure and take me for lobster. You even know what I mean by that.
Okay, la próxima cuando va para Margarita que la lleva a comer langosta.
Yeah.
Okay.
Take me, eh? Not,
Te lleva la cámara. Te lleva la cámara para que-
All right, next time. That's all I have to
Carry
say.
the camera so you can film it.
Yeah, next time you take me for lobster too, eh? Take me for lobster too. So ladies and gentlemen, make sure and call Dr. Ortega. Some of you who really want to look, I can tell you something. I had a friend. They were here. When you were the last time you all were here, Charmaine?
I was in March.
In March. Another friend who she was really depressed and whatnot, and she had a lot of issues going on and thing, and she just neglected herself and so. Boy. I mean, I don't want to call names. I don't want to say them, but I referred her to Doc, and I saw that girl just a couple of days ago. Wow. I was like, wow. That couldn't be. It couldn't be the same person I met in March. So these people are there are people, and because of patient confidentiality, I can't say, and I would not say he likewise, but he's amazing. He's an amazing guy, I don't vouch, listen, I don't put my neck on block for nobody, but I put my neck on a block for him. So Charmaine and Dr. Ortega, it was so nice of you to join me.
Okay, thank you.
Thank you.
All right, Charmaine, you look well.
Thank you.
But you always have yourself looking good. Let's take a fast break. Thank you.